The hands are the most frequently used medical instrument.
Guten Morgen, Frau Leu.
Dag, Frau Kreugi.
Correct hand hygiene greatly decreases the risk of infection. A little effort has a big effect. It is extremely important to use the right amount of disinfectant. Never forget the tiniest recesses of your hands. These must all be saturated with disinfectant. You must allow the disinfectant to act for at least 30 seconds. In fact, the longer, the better. Correct disinfection of the hands is very simple, yet if not done properly, can have serious consequences. The pathogens of avoidable infections are often transmitted by medical personnel through hand contact. In Germany each year, for example, there are more than 500,000 nosocomial infections, and 40,000 of these end in death. Cost 2 billion euros, and a great deal of human suffering. Nosocomial infections are a consequence of treatment or of medical care in the healthcare environment, for example in hospitals. The most frequent infections concern the urinary tract, pneumonia, and post-operative wound infections. In most cases, healthcare workers who have not exercised correct hand hygiene techniques have transmitted infections to others. Quite often, these infections go undetected. This means the healthcare worker will not alter his or her routine and will repeat the error. There are more and more instances of serious infections caused by antibiotic-resistant bacteria. For example, multi-resistant Staphylococcus aureus bacteria, or MRSA. That's why it's extremely important to disinfect your hands correctly, and it costs very little to achieve the maximum possible effect.
Du weißt noch, was wichtig ist? Schauen die Menge.
While washing helps to get rid of visible dirt, only hand disinfectants are capable of killing invisible germs. The correct disinfection technique has to be practiced again and again.
Richtig Däume vor allem auch noch, gell?
It takes regular training to learn the correct and consistent use of the rubbing technique as defined by standard EN 1500. The UV box highlights any gaps in saturation. Skin areas that have not been fully saturated by the disinfectant show up as dark areas. Germs can survive there. If the hands have been correctly saturated, they have a consistent blue coloration. Up to 1/3 of all hospital infections can be avoided in this way. Don't forget, a cupped handful of disinfectant is enough to keep the hands moist for 30 seconds, which is how long the disinfectant takes to act. Palm on palm, right palm over the back of the left hand, and vice versa, with intertwined fingers. Left thumb, right thumb. Fingertips on the inside surfaces of the hands. Always use the appropriate creams to care for hard-working hands, for your own well-being, but also for efficient disinfection. Cracked skin is a favorite hiding place for pathogens. Correct and conscientious hand hygiene helps to prevent nosocomial infections.